Welcome back to What the Health Confessions of a Black Nurse. I'm so happy everyone's taken time to come back and listen to our next episode. Thank you, thank you, thank you. And for any new listeners, welcome. I'm sure you're going to enjoy this show and hopefully it's entertaining and educational. So today we're diving into one of the biggest battles shaping up for the future of your health and mind. Big Pharma versus personalized medicine. Is our healthcare system really designed to heal, or is it designed to keep us dependent? Over the next 30 minutes, we're going to explore how pharmaceutical companies influence everything from doctors' decisions to medical research. Why personalized medicine is rising as a powerful alternative, and ultimately which side will win. The future of healthcare. Stay with me. This one might change how you see your prescriptions, your doctor, and your own. All right, welcome back to segment 1. What's broken in healthcare? Well, that is a huge question. You and I both know, at least in America, chronic illness is everywhere. Heart disease, diabetes, autoimmunity, anxiety, depression. We live in one of the most advanced medical eras in history, and yet we are the sickest that we've ever been. How did we get here? Like, really, how did this happen? Well, our current healthcare system is built like this. You get sick, okay? You go to your doctor. You get a diagnosis. Then you get a medication. And if the medication doesn't solve it, you go back to the doctor. You get another diagnosis and you get another medication and another. And don't get me wrong, medications save lives. I have needed medications multiple times throughout my life and still currently do. So don't get me wrong, I'm not a medicine basher. Medication does save lives, absolutely. But they're often used as a first response, not the last resort. And that's truly what medications were created for, last resort when managing disease, a medication to solve the disease. And so it's not entirely the doctor's fault, not at all. The system is built on speed. A doctor may only get 7 to 10 minutes with you. There isn't time to talk about your sleep, your diet, your stress levels, your gut health, your hormones. So instead of asking why you're sick, we ask what will suppress your symptoms. Next, we'll take a look inside Big Pharma, the business of disease. Okay, so now, Big Pharma, the pharmaceutical companies, we've all heard of them. Pfizer, Moderna, Baxter, Abbott. Yes, we know. The pharmaceutical industry is one of the most profitable in the world. They're valued at over $1.4 trillion. Now, this isn't a villain story, don't get me wrong. Pharma companies create life-saving drugs, insulin, antibiotics, cancer therapies. We do need them. But their business model depends on their customers staying sick. So it makes you wonder, are they really solving things or are they creating customers? Food for thought. Here's how the system works. A new drug is developed. It gets a patent, okay? Meaning they're the only company that can sell that drug for the next 20 years. The longer you need that drug, the more money they make, okay? So ask yourself, what's more profitable, a one-time cure or a lifelong customer? Then there's the marketing, okay? Which I'm so against pharmaceutical commercials, but we'll get into that later. But did you know, in the United States alone, for every dollar spent on research, $2 is spent on advertising and lobbying doctors and people to use the medications and politicians to make laws in their favor. That means commercials, glossy brochures in doctors' offices, medical reps bringing lunch to clinics, funding of medical school lectures, even peer-reviewed journal articles being written by pharmaceutical ghostwriters. And this creates a system where medicine or medications become the default answer. Not the answer because they're always the best answer, but because they're the most marketed answer. So it's the answer most of the consumers know about. Like literally, I can watch a TV show. Like right now, I'm into Reasonable Doubt and I'm, into the new season. If I watch Reasonable Doubt on Hulu, literally 80% of the commercials or ads that I see are for medications. Sometimes two in one little ad sequence, and there's only two ads in the sequence. So it's like ridiculous. There's so much more to taking a medication, and there's so much that comes before a medication is an option for a patient that they should not be marketed to patients without those other steps being marketed first or marketed along with. But I really don't believe pharmaceuticals should be marketed at all. Now let's talk about the rise of personalized and functional medicine. Okay. We all know me, Delilah, I am a certified functional medicine practitioner, but I also believe in traditional Western medicine. I also practiced as a registered nurse for over 20 years. I hold bachelor's of science in nursing. Oh, I know my shit, okay? I've been around. I've been in the healthcare world for the last 25 years. So I'm coming from both sides of this story. But personalized medicine is growing fast, and it's 1,000% the way that I would go and would have been going my entire life had I known better, but I didn't. Instead of the one size fits all personalized medicine, ask what's happening in your body. We ask about your genes, about your parents, about your siblings, about your grandparents. So we know what genes you carry in your body. What foods work for you? Not what are you eating? How do you feel when you eat that food versus how do you feel when you don't eat that food? What environments or stressors are triggering your symptoms? It's no secret that some professions, their employees are sicker more frequently than others. Great example, kids, teachers. Teachers get sick more than probably most employees in any profession because they're exposed to kids all day and kids are nasty. Don't come for me about that. I have 3 kids of my own. I know the deal. Kids don't wash their hands. They have to be told everything all the time. They eat off each other's plate. They drink out of each other's cups. They use each other's straws. They use each other's makeup. They don't think shit about that. And they don't know what kind of environment, homes, nothing that they come from. They are just walking germs. So teachers pick up all those germs all fucking day long, because no one's coming in disinfecting in between every single student every single time. So teachers get sick a lot until they build up immunity to these things because of their environment. Okay. So, but if you don't know that, that's a huge piece that's missing when you're trying to treat a teacher for some type of illness or virus or bacteria. In functional medicine, which is the type of medicine that I practice, and precision health, we run deeper labs to get into what is going on inside of you, not why are we seeing what we're seeing. Most labs that are currently run for patients, they're run so that the doctor can see if what you're reporting or what we're seeing makes sense. Like the labs typically verify or lead us in the right direction to what is going on. But in functional medicine, we do labs to see what is going on inside of your body, what's going on inside of your gut, what's going on inside of your stomach, what's going on inside of your brain, what's going on inside of your lungs or heart that are causing you to feel the way you feel. So let me give you a little quick story or a case study, a little breakdown from my practice. I have a 48-year-old woman, her name, let's call her Maria. And yes, I do have consent to share this with you. She came in with fatigue, brain fog, anxiety, and pre-diabetes. That's what her primary doctor diagnosed her with. She wasn't quite happy with that. And so she came to see me. And her primary doctor, she told me, offered her antidepressants and told her to eat better. So I did a more thorough assessment, as I do, and I told her my plan, and she decided to go the functional medicine approach instead of the traditional medicine approach. And we did some stool tests that showed that she had gut dysbiosis. So her gut was just really attacking her body because she kept putting things in it that it couldn't digest, it couldn't break down, so it's not getting the nutrients that it needs, etc. So, and that she had a gluten sensitivity. We did some hormone labs, which showed her cortisol was out of balance, which helped me help her get a handle on her chronic stress, because that's why her cortisol was so out of balance. But a lot of why she was stressed is because she felt like shit. We also changed her nutrition to support her gut health and get her absorbing nutrients properly. We got her sleeping and getting actual deep rest rather than just napping all night long. And 3 to 4 months later, actually, it was more like 2 to 3 months later, we had no more brain fog. She was not pre-diabetic. Her hemoglobin A1C was normal. And she said she feels like she has her life back. And that's how come people are looking more into the traditional medicine option, the functional medicine or personalized medicine options versus traditionalized medicine. And one of the issues with personalized medicine is a lot of it is not covered by insurance yet. There are many things that were not covered by insurance 5 years ago that are covered now, like telehealth. So it does take the system time to catch up, but I do believe it will catch up, and more personalized medicine will be covered by insurance. People also say that it is more expensive. Our lab testing is a little bit more expensive, but overall, the care, you either pay a little more upfront for feeling better in 2 to 3 months and not having to take prescription medications for the rest of your life and see the doctor every 3 to 6 months for the rest of your life to keep getting that prescription refilled, and then now having labs to make sure it's not causing problems somewhere else. Because even if you don't feel the side effect, there is a side effect going on inside your body. Okay. So yes, it can be more. It does not cost more. It actually costs less, but there is more of an upfront cost versus with how traditional medicine is funded. That's the power of looking for the why and not just the what. Functional medicine doctors are more like detectives. We're always looking for the why. Traditional doctors, just because of how they're taught and the guidelines that they practice within, they are more looking for the what, but I promise you, any of them will gladly look into the why if you advocate for yourself and ask them to help you find out why. So now, AI, genetic testing or genetic sequencing, wearable devices, continuous glucose monitor, all these tools are personalized medicine tools. And that's part of what is pushing people into the mainstream. But I strongly suggest that using any of those tools, sequencing, wearable devices, glucose monitors, Fitbits, that kind of stuff, you need to be doing that in conjunction with some type of licensed healthcare practitioner, because they are just tools. Sometimes they can make you believe you have something you don't, and you're stressing about things you didn't need to stress about. Other times you may not know how to interpret the data that it is giving you, so then it's useless anyway, and it's not something that a Google search is gonna give you, because that requires critical thinking, which no AI tool can critical think. All right. We'll be back in a second where we'll get into how these two types of care the collision is coming. And so the question is, can these two healthcare worlds exist together? Let's see. Okay. So does it have to be pharma versus personalized medicine, or can they work together? Well, imagine this future. Your genetic data tells you which medications work best for your body. Your wearable tells your doctor when your inflammation flares before you feel symptoms. Medication is used, but with the purpose and with the personalization, and not as a lifelong bandage. Big Pharma isn't going away, but it might have to evolve to the changes of the customer and what the patient is wanting for their care. Functional medicine also can't replace emergency care or antibiotics. Functional medicine is not uh, primary care. It's not even, or no, I take that back what I just said. Functional medicine is a primary care. So just like you would see your routine doctor, that's how you would see a functional medicine doctor or a functional medicine practitioner or like your nurse practitioner. But just like your primary doctor, he cannot replace the emergency room. If you're having a heart attack, you don't go to your primary doctor's office. You go to an emergency room connected to the hospital. And that's never going to be able to go away either. But it can solve what medicine has been managing for decades, the root cause of chronic illness. That's really what medicine is. The future isn't about choosing a side, it's about demanding a system that heals you, not just treats you. It's about demanding a system that doesn't make you dependent on it when you enter it. And currently, that's what our system does. We are not educating our children or ourselves from early on how to maintain the health of these magnificent bodies that we have and how to maintain the health with food and nutrition and with exercise and with environment and with meditation. And we are not teaching that. And that is how come chronic illness is just growing. All right. So before we wrap up, let's go over the big key takeaways from today's episode, which is our healthcare system is designed to manage disease, not to prevent it or reverse it. There's nothing preventative going on or curing going on with the conventional medical system, okay? In the United States. Big Pharma plays a vital role in our healthcare system. But profit often drives their decisions, not healing. I say big pharma is like those people who don't need health care. No one cares about the quality of your care or the cost of the care until they need the care. Big pharma doesn't need the care, so they don't care about healing. They care about making money. And we have to keep that in mind when we're dealing with them. Personalized and functional medicine look for the root cause instead of masking symptoms. And that's really how we should be educating the public in regards to how to care for themselves. We should not be making the public believe with all this marketing and commercials and this and that medication is the first resort, the first step, second step, or even third step most of the time. There are many steps that come before medication, but our society is just not even seeing them or hearing them because they're bombarded by marketing from these pharmaceutical companies that want us to become dependent on their products. AI, genetics, tech are truly personalized medicine in the next era. They're the personalized medicine of the future, and they all are good things, but they are just tools. It takes a person to take all the information gathered from those tools, critically think, and come up with a plan for you. So if you think that you can manage your healthcare with Dr. Google or some AI tool or with your Apple Watch, you're mistaken. You need a healthcare professional that can take that information, critically think, ask the questions that are not being asked by those devices and tools, and then, package it up for you and guide you in the right direction and teach you what to watch for, not watch for, what your body's tolerating, what your body's not tolerating, etc. The future belongs to an integrated care model. It's going to be personalized medicine and medicine back in the home and medication when necessary. But personalized always should be occurring, whether medication is necessary or not, because medications also react differently in every person. So just because I take a certain medication at the same dose at the same time as you every day does not mean it is going to address our issues exactly the same way or that we're going to experience exactly the same side effects and things. because medicine is personal to whatever is going on with the person, the patient. So, in closing, my call to action to you is if this episode made you think differently about your health, please share it with someone you love. Let me know that. Post it to your stories, tag me, start a conversation. I love talking health, and I can always steer you in the right direction, even if that is not me. And if you're ready to explore personalized medicine for yourself, please join my community in the show notes. There will be a link in the show notes. We're at Healthcare Navigator. You can find me there because I'm the healthcare navigator. I help people navigate their health, or I'm a healthcare fixer, I like to call myself. Don't be just a patient in the system. Be a participant in your healing. That is the only way you're going to ever feel better. I'm your host, Delilah, and this was Big Pharma versus Personalized Medicine on What the Health, Confessions of a Black Nurse. Thank you for listening. Please don't forget to follow and subscribe, and I will see you next time. Thank you. Bye. Podcast disclaimer. This podcast is meant to educate and inspire, not to provide personal medical advice. I'm not your doctor, and this is not a substitute for professional care. Please talk to your healthcare provider before making any health decisions based on today's episode. Thank you. I think that went crazy.